We often get asked the same questions about teeth straightening and whitening, and here we are going to address some of the answers with Dr. Alok, our CEO. Many people ask about teeth whitening, whether it's safe or it can damage your teeth, and also they want to find out if they have to wait until the end of their treatment with clear aligners or if they can start the whitening in the middle or at the beginning, like how does it work?
The first thing that's important to understand is what is the product used for teeth whitening. If it's dentist prescribed teeth whitening, then it will be an approved product, and then yes, it is safe. It's the same impact as drinking like a glass of orange juice on your teeth. And the gel is used within trays, which you would wear generally overnight. This means that you have enough time for the teeth to become whiter, and it's also a gentle process as well. There are some other teeth whitening products available which may not be safe, but that's why it's always good to get one through a dentist, basically. So whitening in general, how does it work? So our teeth have two layers. We have the enamel on the outside surface of the teeth, then we got the dentine underneath it. The enamel is always milky white, and it's a thickish layer, but it's not that thick. The thicker layer is the dentine underneath, which is more of a creamy colour. It's got these thin little, almost like glass tubes that run through the tooth. Over time, the enamel thins a little bit. It can thin through acidic foods, juices, things like this over time, which then means the natural whiteness of the tooth is reduced a little bit. Then you see more of the dentine underneath, which is a bit more creamy yellow colour. To add on top of that, coffee, tea, coloured compounds can get blocked within the tubes of the tooth as well, which then makes the tooth appear darker. So teeth whitening in a gel is able to go through the tooth, clean, and help brighten the tooth from the inside out. Now, in asking the question about in-office versus at home, so if you're whitening your teeth in an office, you have reduced the time for the tooth whitening to happen, so you have to increase the concentration of the gel. The trouble is, if you increase the concentration of the gel, it makes your teeth more sensitive. You don't have as much time for the tooth to actually be whitened by the gel. That's why it's better to do an at-home solution. An at-home solution means you can reduce the concentration of the gel, you have more time for the tooth to be gently whitened, and it also lasts for longer because the tooth has actually been whiter from the deeper part of the tooth. So if you're having your teeth straightened with clear aligners, you're wearing trays upper and lower during your treatment. The gel would go within your tray as described by your dentist, and they would give you all the instructions for that. But this means that you could actually choose to straighten and whiten your teeth at the same time if you wanted to, or if you preferred to wait until the end when your teeth were straight, then you could whiten your teeth. It doesn't really matter either way, as long as you're dentally healthy and you've been supervised for it.
Some people have asked how is it possible to move teeth with clear aligners without IPR or without tooth extraction? Like, how is that possible?
When teeth are crooked, it's because there isn't enough space for them to sit next to each other. So if we imagine all the teeth sitting next to each other in an ideal form, they're what we call like an arch, like a horseshoe shape. But in many situations, some teeth are too far forward or too far backwards because there isn't enough space for them to sit next to each other. So then the question is, how can there be enough space for them to sit next to each other? Do I need to have a tooth removed, or do I need to drill or smooth between the teeth at a dentist to do that? Well, in many situations, it's possible to actually improve the shape of the arch. This is because most teeth lean inwards, and by using aligners program specifically, you can upright the teeth to have a nice, wider, broader smile. This actually increases the diameter, which means the circumference increases in maths, basically. Then you have more space to straighten the teeth, and this can then be done without having to drill between your teeth or have to extract any teeth.
And this one we get asked the most. It's, can I have my upper or my lower teeth only straightened?
So many people just really want a nice smile, and to them it's the teeth that they can see when they are looking at a photograph or in the mirror, and it tends to be their upper teeth or their lower teeth. So naturally people ask the question, can I just get those straightened? It's a natural question to ask. The trouble is, the teeth don't exist by themselves. They exist as part of a set, and the upper and lower teeth have to meet when you're chewing, when you're speaking, and in order for them to meet together, they have to have the same width. If you are expanding an arch in order to create space for the teeth to straighten into, you've made it a little bit wider. This means you need to make the other one a bit wider as well, so they can sit together nicely. Otherwise, what would happen is you could have straight teeth in one place, but they wouldn't meet properly in the other place. This is why it's important to do everything in tandem.
Thank you so much for all the insights that I'm sure you found very useful too. And if there's anything else you'd like to find out about teeth straightening or whitening, Please write your comment in the comment box below and we'll make sure to address them in the next videos. Thank you so much for watching. Hope to see you soon on Straight Teeth TV and StraightTeethDirect.com.